So, good afternoon, everyone. I am Dr. Pranay and session C. This is a weekly session that we have wherein we will be discussing our cases which we have completed. We will show you a few cases so that you also get an idea how to proceed with your cases, the kind of cases you should choose, what kind of cases you can start with, gain confidence in your aligner practice, and how you will proceed further. Now, you may be an aligner provider already. You might have worked with other aligner systems, or you might be a fresher wherein you haven't had any experience with aligners. So this will give you a brief idea of what aligners are, the kind of cases that we have at our end, which we have worked on, and the kind of cases you can look forward to treating in your practice with aligners very effectively. So we'll be beginning with the session and we will take you through. All right, so we will start with Odonto Odyssey and what it is. So it's an initiative that we have on a weekly basis where we clear your concepts regarding aligners. So the clear concepts, clearing out all your concepts right from the basics as to what aligners are, how they work, and how you can proceed with your cases. All right. So Odonto is basically a dental company which provides aligners which are specifically designed for dentists to help them out with their orthodontic treatment that they would like to offer to straighten teeth, correct malocclusions which are present in terms of rotations, if there are any spacings which are there, if there is crowding, and it is an alternative to traditional braces that we have. Now, traditional braces, you will have a sequence wherein the wires are changed, the different materials is switched or adjusted. Similarly, you have clear aligners wherein you will have a sequence of trays which are fabricated, and each tray will have an increment of changes which take place. So we have a certain limit, a certain threshold which is present, and based on that, there will be small increments of change. So if there are spaces which are present, then with every tray, the spaces are going to reduce. If you have crowding, then the crowding will unravel, the crowding will get corrected with every passing tray. As Odonto, as a company, what does it offer? It offers you everything right from the start, right to the end of treatment and beyond. So in terms of start, what does it offer? That it helps you out with case selection. So if there are any cases that you have and you would like to offer aligners as a treatment modality, then is it a case which is viable for aligners? Can the entire case be treated with aligners? How many sets approximately will it be taking to bring about those corrections so that you can give a clear idea to your patient as well? So it starts with that. We will help you out with the scanning part of it. The treatment planning is done by orthodontists only. We do not have technicians or other lay people who are carrying out the planning for your patients. So there is a certain dedicated team of orthodontists who plan the treatment, what treatment is possible, whether any extractions are required, any interproximal reduction of tooth material is required. All these plans will be provided to you. You will be given a clear idea as to how to go about it. The other part that we help out with as planners is also the type of retention which will be required post treatment is over. Sometimes you have cases of diastemas. They might require fixed retention in addition to your clear aligner, a clear retainer, or any other retainer that is available. So in terms of deciding on that factor, if there is any splenectomy which is required in those terms to plan out, if there are missing teeth and you want to have a certain treatment wherein you're bringing about correction of that, but at the same time you want us to create space for your patient. Sometimes there are molars which are missing or premolars which have been lost, and you want to gain space so that you can provide a prosthetic replacement for that missing tooth. So in those terms also, we help you out with planning as to what is feasible and what is not possible, and if there are any limitations to that. We also help you out with the fabrication of the aligners. We do it ourselves along with delivery so that everything is provided to you. You will also be receiving assistance in terms of attachment bondings. These small attachments, I will be showing those as to what they are and how do you place those. If proximal reduction is to be done, at what stage it is to be done, if it is to be done right at the start, then we help you out with that, how to carry it out properly. We have few links for that, wherein we have videos which have been prepared for the purpose of your understanding and so that you can use the same method in your clinic for your patients for offering the same type of treatment. During treatment, if there are any issues that are encountered, in case you are stuck at a certain stage, you feel that the tray is not fitting, you want to troubleshoot that point, then how do we go about it? So you don't have to feel like you're going to be lost in that process. We will help you out at that stage. You always get in touch with the person. There will be one person who will be appointed to you. You have to, once you're part of the aligner provider program with Odonto, and that person will always coordinate with us and we can always help you out as to how to troubleshoot any problem in case the patient hasn't worn his aligners, in case the patient breaks the aligners. So how do you proceed in such a case? So we'll always help you out with troubleshooting in that part. At the end of treatment also, if you feel that there are certain corrections which are required, if they haven't tracked completion and you still need those, so we call that refinements. So if refinements are required, then we help you out in that aspect as well, as to how to send about a new scan or a second set of impressions. And you can finish it up and proceed to the retention part of your treatment. So we offer everything right from the initial stage as well as the logistics which are involved. And then during treatment, we will offer you assistance and post-treatment in terms of retention or any other issues which come with. So, what is it that we focus on in today's session? It's basically a short session wherein we will show you a few cases. And I am a planner myself. I am Dr. Mrinmay. And as a treatment planner, what it is that we do, because this is something which is related to your clinical part, wherein we will help you to, we will guide you in terms of what sort of cases you should pick and choose right at the start so that you have an idea as to what cases work very well comfortably with aligners with very few hiccups on the way, so that you also gain confidence in your practice. And then you can move on to the more complicated cases. And you by then you have an idea as to how to go about them. If there are any issues, you will be able to tackle those with your own experience. So basically, we are trying to help you gain that confidence in terms of expanding your scope and understanding of what aligners are, and then proceeding from there. So we will have our cases which we have done ourselves as in terms of at Odonto. We are a team of planners and our cases will be on display today. So we will take you through the varied types of cases which are there and how we go about them. So if this is one of the first cases that we will start with, which is we can see that there is an anterior open bite. The relation is fairly a class 1 relation, and there is mild crowding in the lower anteriors, and the upper arch is fairly well aligned, but our main concern is the open bite which is there. So in such a case, we would want that our posterior occlusion is quite stable. We would not want to play around with it, though we will have some amount of intrusion to aid in closing the bite. So how do we proceed with this case? We will show you the video for this, and this video will take you sequentially through every step. So you will see that there are like multiple stages which are there. It shows the amount of change that takes place with every aligner and how it will progress to the finish. So as you can see over here, we have a closed bite. We have this is like mid-treatment, which is there at the start in the anteriors. So we have the bite which has closed, the crowding is unraveled. This is, there'll be a slight space in that region, but that is also related to how the shape of the lateral incisor is, which will play a role in that space, but that can be corrected with cosmetics, cosmetic build-up as well. So we can see that the bite at the posterior region is not changed. It's a very stable bite. We haven't altered it. But at the same time, we have achieved our treatment goal of closing the anterior bite as well as alignment of teeth. So I will just take you through the video, and it shows how sequentially we gain space. There will be a slight amount of expansion and we bring about closing of the bite. If there are very large bites, they're beyond 3 millimeters or so, we will have to incorporate elastics, which the patient will have to wear in the anterior region. And in the posterior region, we will only have attachments. So even if the teeth at the back are not moving, you will notice that there are attachments which have been placed on the molars. Like, why do those come? We need to be able to fold the aligner in place. So we need something which is known as a retentive attachment to help us with holding the aligner. We don't have braces or so. So how does the plastic hold itself when a lot of tooth movement is being brought about? So which is why we have these attachments which are there on the posterior. In the anterior, we will have attachments which will actually help in bringing about that bite closure, to help us with a correction of rotations, to help us with closing the spaces. And at the same time, we will have these rounded attachments are actually wherein we have to bond buttons on the teeth for the patient to engage elastics. Now these, because they are in the anterior, you will have to place aesthetic buttons. If they're in the posterior and the patient is okay with it, if that's just a molar, you can go ahead with the metal buttons, or you can always go in for your aesthetic buttons, which will be placed on which the patient has to engage the elastic. That is like an added force that is placed for the bite to close effectively. Because there's a limitation as to how much of an aligner can pull the teeth towards each other, which is why you will have the elastics which come into the picture. As well as you will see a few other attachments which will be present. They will be either for, again, retention purpose or to bring about a rotation correction also. So open bite cases are very favorable when you are considering aligners. So in your practice, if you are coming up with a patient and if it is a dental open bite which is present, then you can always go in for aligners as a treatment option, because the aligners themselves inherently, they will have a force which will act on the posterior teeth and it will help in closing the bite, which is why the posterior bite will be still stable throughout the treatment. And as the intrusion takes place, you will have the anterior bite which will close. So it will have a synergistic effect on your tooth movement that you are trying to achieve. That is one part. If it is a skeletal open bite which is there, and also a dental component which is present to it, then you can always go in for correction of the dental component with your aligners and then progress to a hybrid approach wherein you will have to incorporate either mini implants will be required. You can incorporate those, or you can have like a hybrid approach in wherein conventional braces are used at a later date, because there is a limitation as to how much the aligners can correct. Have like mild, moderate, and severe categories. If it is in a severe category, then you can always consider these multiple modalities and try to combine them to offer the best for your patient. So this is one of the open bite cases. I will show you. Okay, here we have another open bite case, but this is slightly different as compared to the previous one. We do not have any crowding whatsoever in this case. We have a lot of anterior spacing. We have a good diastema in the upper arch, and the posterior bite is again pretty stable. So in this case also, you'll see the attachment types are different. The reason is that this open bite is not as severe as the previous open bite, wherein the attachments will be sufficient to bring about bite closure, as we can see in the post pictures over here, wherein there is a good overlap. That is, we have achieved a good overbite which is present. Now, when you receive a plan from Odonto, if there is an open bite case, as an orthodontist and as a planner, what I need to program is I have to show some amount of overcorrection. So if you have that, the patient is starting off with an open bite, and by the end of it, you're showing me a almost a deep bite. Why is that happening? You have to factor in and explain to the patient when they will see this, that we are trying to bring about a certain overcorrection which is there. This is a concept which is not very easily understood by your patient, but to a certain extent, you need to be in a position where you make them aware of it. So that's something you need to keep in mind. So if you have a deep bite case that you send us, we will always show it as probably, we'll overcorrect and show what is possible. Now, what comes under mild category is up to 2 millimeters. Anything up to 4 to 6 millimeters will go into your moderate category. Beyond that, a correction goes into your severe category. This is in terms of linear movement. If we are talking about rotations which are present, then those rotations, we can say up to 15 degrees, mild category can be easily done. We don't need to worry about tracking as much. Attachments will work very well. Anything beyond 15 degrees, we need to start looking at other forms of auxiliaries that have to be used. That is in terms of elastics or buttons, as we saw in the previous case. Something like that comes into the picture. But all that will be explained very well to you in the treatment plan and the note that you will receive when you receive a plan from Odonto. So we look at how this case progresses. Again, we have your attachments for bringing about the bite closure in the anterior and posterior section. Though there isn't any movement that is taking place, we need those retentive attachments which come onto the molars to hold the aligner in place. Now, the reason why those attachments, they can be different. They can be at the start or they can be added on during the course of treatment. There can be a few attachments which are required. But the reason they are necessary is because we need a hold on on the patient's teeth as we are progressing with it. Now, these cases are also available on the Odonto site. So in case after the session, you still want to go back and have a look at it, or if you have a patient and you want to show them that this is what the aligners can achieve and what is it that the patient can expect out of the aligners, you can always go back to the link that is provided to you, have a look at them, and then you can share them with your patients also, show them the different cases which have been done and what they can expect for themselves. Okay, so we move on to another mild category case. Now, this is a mild category case because there's just one single tooth crossbite which is there in the anterior. There we have a blocked out central incisor, and there is a lower central incisor which is in crossbite. So how do we progress with such a case? We will require some amount of proximal reduction because we first need to make space to correct this crowding. And then we proceed with bringing the teeth in line and correcting the crossbite. This is again in a mild category. Up to 15 to 20 sets will be required for a single tooth crossbite to be corrected, wherein you have to ensure that you don't have a lot of other malocclusions taking along with this single tooth crossbite. It can't be that at the posterior you have a lot of rotations which are there, or you have anteriors, you have severe crowding, plus you have a crossbite. Then in that case, what happens is your category immediately changes from something which is mild. It moves on to your moderate to severe category, depending on what is present for that patient. But if you have something simple in this scenario, which we have right now, wherein you just have a single tooth crossbite, the posterior occlusion is quite stable. We need to relieve this anterior crowding, which is present, as well as the upper arch crowding. So this can have a look at how it progresses with the same. We bring about a certain amount of expansion of a little proximal reduction will have to be done in the anterior segment, and then we push the teeth into the arch shape. So this is again, which was something which will fall into your mild category. Does not require the use of elastics. To this degree, you will not require. But if it's a really blocked out or an instanding incisor or a posterior tooth which is there, then you will definitely have to move on something wherein the patient will have to wear elastics to aid that movement into occlusion. Again, something else that needs to be noticed and taken note of in terms of crossbite correction is that we need to place certain bite ramps on the teeth. Now, these bite ramps are for the purpose of disocclusion. what they will do is they will disocclude the, sorry, they will disocclude the teeth. So there will be ramps on the posterior teeth which are given. What they do is basically they open up the bite to allow for this cross bite, for the jump in the bite to take place and correct the patient's cross bite. So they're placed on the posterior teeth. We just now those are not attachments that you have to place on the teeth. That is something that you need to that will be part of the aligner, and you don't need to specifically place anything for it. It will just be a raised platform, raised surface on the aligner, which is there. And we can have, right. So here you can see these on the posterior teeth for the purpose of disocclusion. These blue bars which are there, they're actually just to open up the bite so that anteriorly the teeth do not have an interference or they don't knock into each other as the correction takes place. So this is the purpose of the bite ramps. This is just something to give you an idea of how the aligners work, what are the different components and parts to the aligners, and what each case requires differently during its treatment process. If you want to know about these parts and everything in depth, then you can always join in with the aligner provider program, which we call the APP. And in that program, we give you an entire overview of aligners in terms of what the mechanics are, so that you also have a good understanding of how the teeth movement takes place, what are the forces that act on them, and how do you understand those, as well as when you offer the treatment to the patient, how do you go about that, as to what is it that you would have to do as a clinician for your patient to get a good understanding of it during the extensive aligner provider program. So one of the final cases that we'll be showing, it's a moderate category case. Now you can see that you have a lot of crowding in the anterior region. There is a difference in the level of the teeth as well as the placement of the teeth. They are not placed in a single line in terms of the line of occlusion is different. The level of occlusion is also different. There's a lot of crowding. There are instant teeth. The shape of the teeth is also not extremely towards the normal. It's more of a microdontia or a peg lateral is what one could have. So how do you proceed with such a case? Now, this is not one of the ideal cases that you would start with. I would suggest that this is a case you take up after you've had some amount of experience with aligners, with mild crowding cases. Also, if you have that sort of experience, it works out great because you will have confidence as to what you are offering to the patient during treatment progress. You'll be able to communicate better with the patient once you have that experience in hand. So what sort of treatment modality is an option in this patient? A sort of proximal reduction will be required for this case. It will be done sequentially in multiple stages because we do not have good contacts to start with right off the bat, that we can just start removing tooth material from all contacts and then just bring them in line immediately. Now that kind of plan, a lot of people offer it, but it does not make sense because even though we can offer you something straight off, we want to ensure that it is within your biological boundaries, wherein you will receive a good result with it in terms of relieving the crowding which is present, as we can see over here in the post-treatment pictures. So how do we go about this? The initial stages, there will be some amount of proximal reduction that is planned out. There will be expansion, which will be carried out, as we can see in the lower arch also. Then what we do is we start moving the teeth in one plane at a time. We first will correct bite, eventually going on to proceeding with correction of your rotations, which are there, the alignment, if the teeth are tipped, that's how we will be bringing about the movement. We cannot bring about a lot of movements at one time because what happens is that force does not always act or transfer onto the tooth perfectly. So what we need to do is that we need to we have to stage it in a manner that initially we will have your crowding, which will unravel. We will gain space for it. Then we will rotate the teeth, bring them up straight and aligned. So this is something that we need to stage. The staging is extremely important for the reason that we want to ensure that the teeth move sequentially and they move in a manner that it doesn't have any interference as the movement takes place. So we program a lot, it gets very confusing in terms of the force acting on the tooth. That's basically what is happening in terms of biomechanics. And we want to avoid that because we want to give a plan which will help out in unraveling, aligning the teeth, and then having a good occlusion. So that is how it goes about. Which is why this is not one of the cases that you would want to start with. But if you have been practicing with aligners, if you have experience with aligners, with simple cases, then you can always move a step up to moderate category cases and all have a good correction with such. These kind of cases, you can also, as we can see that if you want a very aesthetic result, if there is microdontia or as I mentioned previously, or there's a peg lateral which is there. If you want to go in for correction of the same, then post orthodontic treatment, you can always go ahead and correct that in terms of either a veneer or the multiple other options which the patient will have. And as to what they opt for, you can always give that to the patient. That is how. Yes, so these are the cases that we've had for this week and we have discussed. If there are any questions that you would have pertaining to case selection, the kind of treatment which is possible, if there are questions regarding attachments, proximal reductions, anything that you would have, you can always drop them in the chat box. Or if you want to unmute yourself and you want to ask those questions, you can proceed with that and I will help you out with those. If you want to learn more about aligners, how they work, what sort of aligner treatments are aligner treatment in terms of the type of cases that you can treat. If you want a better idea of that, you can always join for the APP, that is the Aligner Provider Program, wherein we will in depth discuss the physics of aligners, what are the types of aligners which are available in terms of the material of the aligners, in terms of any case like the one which you can see on the screen presently, which is the crowding case, which is a moderate category. Now, if you want a better functioning aligner material, then we also offer something which is known as a Zendura material, which is a superior material in terms of it has better capacity to have for the force to act on the tooth. So the material does that. In terms of your PETG, which can be always used for mild cases, even in some moderate cases, the PETG material works out very well. And so you will learn the differences between the two. What kind of movements can be brought about with aligners? What kind of movements aligners are restrictive to in terms of the deep bite cases? They don't always work out, especially if it is a skeletal deep bite. They're very difficult to treat even with aligners. Conventional braces itself, it's quite difficult to treat a skeletal deep bite. So if aligners is something that we're looking at, that needs to be checked because not always do they work out. So to what extent can you use an aligner to correct that bite? That's something that you will learn with the aligner program. We will leave the link for the same for the aligner program for you to enroll in. If you are interested, then you can always leave your name and contact number in the chat box, and we will always get back to you regarding the same details of when the following program will be, how to enroll for it. After enrolling, how you will be you will be in contact with a person who will be dedicated to handling all the logistics for you in terms of sending the scan, coordinating for the scan, how to send that about, if there are the forms that which have to be filled out, if there are any questions or queries regarding the same. So there's an extensive form that we have that we want the provider to fill when they're sending in a case. So that helps you to communicate with us as to what it is you wish in terms of treatment outcome. What is the patient looking for? Because aligners is something which is a very aesthetic treatment modality. So patients come in with a very specific idea as to we want particular correction. We want just the anterior correction. This is my main concern. This particular tooth is bothering me because I feel it's too out. So if the patient comes with any particular concern, you have the form which is available wherein you fill those out specifically so that even we, when we are sitting to plan, we know what it is that your patient is looking out for, and we also have a better idea. So that helps out with better communication, and so that right at the first plan that you receive, we try to give you a plan which is exactly in terms of what your patient is also looking out for. So when you fill that out, it helps. So how to go about that, everything will be helped for you. So right, so we've shared the link for the enrollment. In case there is any question anyone has regarding the cases that I have shown today, any question pertaining to the case, you can ask that question right away. Any other questions that you might still have regarding the aligner program, you can still put them up in the chat box, or you can unmute yourself and ask that question. I'll address it for you. Are there any questions? Not here. In case anyone would want to go over any case, we have a recording of the same that is available. You can provide that, and you can always go through it and again get back to us with any questions that you might have through it. That's also an option which is available.